due to interest of time, I can, open this floor for that question and answer session from the audience. If you would like to ask any, we can take one or two questions if you'd like to ask anything to our speakers. Anyone like, how you can incorporate this equity focused, gender responsive evaluation for your, recent work? Yeah, she.
Thank you so much for everything that was shared to all the resource persons. I've learned a lot during this short span of time. Now, since we were on the topic of intersectionality, intersectionality, we talk about powers and privileges, marginalizations, vulnerabilities, and how do they interplay when we talk about, now in this conversation, we are talking about SRH. But if I am to ask you about SRHR, including the rights, if we are talking about rights as well, how do we make, how do you go beyond focus on individual rights and ensure there's equity in terms of justice, because something that we try to promote in SRHR work is that, we want to say there must be reproductive justice, and our work, our strategic interventions must be designed in a way that will ensure that there is justice, not just affirmation of rights individually, but we look at groups. We look at marginalized groups, regional contexts, which are, sometimes similar across regions, similar challenges, but sometimes very specific and different. So, in your work, do you adopt this lens of, ensuring that there is a reproductive justice approach to your work around SRH, or, just want to know from your experience?
Yeah, thank you so much. Like to respond?
Well, whenever we talk about evaluations, we always talk about monitoring also. So whatever we talked about right now, is it what we are doing? Monitoring? That's right. Yeah, need assessment, and then the monitoring, and then the evaluation. So
Can we take?
Yes.
Okay, I don't know whether we work specifically reproductive justice, right? But now when it comes to, yes, rights, now in SRH, mainly we are focusing on ultimate results we expect, rights and justice, right? That's what the ultimate result, I think Dr. Soma was, trying to explain about results we try to achieve. Now, whatever we talk about, other things, maybe output level, outcome level, the use of condoms or decision making, or even abortions, things like that, how, ultimately contribute to ensuring rights of people and also SRH justice. Now, that's why our program should be focused on towards that. At the same time, program managers, program implementers should have, clear understanding about what are the results we are targeting. And that's where monitoring and evaluation is also very important. At the same time, this topic we are talking about, equity focus and gender responsive evaluations. So without knowing about different segments of the society or the groups that enjoy their rights and also have the justice, or the groups do not have their rights or justice, that we can definitely focus our programs accordingly. So there is, huge responsibility to the program managers, implementers, and decision makers, also the policy makers. Now, in this conference, we talk about a lot about advocacy regarding abortion, other things, and this morning we had very interesting panels about those topics, and those are the decision makers, right? Policy makers. How do we address them? Now, when it comes to abortions, even I hear that, these days in the political rallies also, that addressing about some of the issues, abortions, and also accepting rights of different groups, accusing other groups, other political groups, right? So this is also coming to the political agenda. But how politicians or decision makers take right decisions based on and according to the human rights of people, right? And rights of people. So those are the important factors we need to address. And again, it comes to when it comes to advocacy or working with decision makers, working with policy makers, again it comes to the program managers. I think program managers, although we talk about equity focus and gender responsive evaluation, evaluators conduct the evaluations and make findings and recommendations. Again, it comes to the program managers to plan effective programs to achieve those ultimate goals. And ensure that people have those rights and justice. So I think there is a bigger role for program managers and implementers. This is what I want to highlight.
No, I think Asela covered it pretty well.
I think monitoring, and also to add a line to this, I really don't know I don't know about the SRH programming, but about an evaluation, any reports talking about just per se. It's not a wide practice. However, when you talk about realizing rights for all people, isn't justice implied there? So it has to be fair, it has to be equitable. But frankly, I don't think evaluators or evaluation methodologies give specific reference, I'm not sure. But programming should definitely do that. And if that's one of their targets, then evaluators can be asked, look at. Very interesting. Yes, definitely very, yeah.
Moving beyond right to just.
Exactly.
And that's the just part. Earlier we called SRH, we called SRHR, now SRHJ. So now the interventions are focusing on the J part as well as that evaluation. We will going to adapt J part to evaluate that how it goes.
Right, and this is where new methodologies have evolved. I know for SGs, the universities were required to come up with methodology. And of course, something we forgot, thank you for raising it, without monitoring, there cannot be good evaluation. So monitoring has to happen right from the beginning, and that also has to be rights. So that should happen, yeah. Thanks.
I mean, when I mentioned that it's a developmental evaluation, it's part of the monitoring as well. You start from the inception or early stage of the project.
Yeah. Thank you so much to my all speakers, Dr. Asela, Dr. Soma, Dr. Munaz. Thank you so much to the audience that for this, great interactive session. Thank you. And with this, we can close this session. Thank you so much again.